Hi guys, hope you're well. It's going to be really it's just started to rain, but this is a super quick video about ICE in consultation based skills exams, whether it be CSA, RCA, medical school, comm skills, PLAB 2. There's so many different exams that you guys have to go through in terms of communication skills, and a term that's bandied around a lot, quite rightly so, is ICE, ideas, concerns and expectations. And we have loads of videos on our social media streams about ICE, when to do it, how to do it, what are the right questions, how to make it less formulaic, etc. But one of the most fundamental things to understand about ICE is what is it and why do we do it? It's not just there to get three answers. You probably know ideas, C, concerns, E, expectations. I'll talk about these in a second. It's not just about getting those three answers, not just about ticking boxes. It's about something much more fundamental to being a clinician. The whole point of ICE is to make sure you're understanding the patient in front of you's mind, understand the issues that are going on in here. Now, if you want to be a good clinician, you can do your medicine, you can diagnose a problem, you can treat a symptom, you can do whatever your test you want to do. But unless you're connecting with the issues in the patient's mind and then putting these as part of your plan, your management of the situation in front of you, then a lot of patients are going to go away unsatisfied, and a lot of your role play marks are not going to be as high as you possibly can. Now, for example, someone comes in with knee pain. You can do a really thorough clinical job in making sure there's nothing acute going on, that you can examine properly, that you can come up with key signs, that you can work out key red flags, you can diagnose a problem, you can give the most up-to-date latest guideline in terms of treatment, and you can clear someone's pain out the way. But if you haven't dug into that person's mind and understood issues such as an expectation, they wanted to have an x-ray. For whatever reason, they wanted to have an x-ray. If you don't get into that part in the first half of the consultation, understand that, and then bring it back as part of your management plan, then that person may well have their pain settle down, but they're going to go home and still wonder, do I need to have that x-ray? Was that something that I should have had? Do I need to go back again and ask if I need to have an x-ray? Maybe the doctor just forgot that. Maybe they were going to do it, but they didn't remember. See, the issue in the patient's mind is manifold. Yes, the pain is there, and maybe that's what they went to the doctor to get sorted out. But often there are other issues in people's minds, and that's what ICE is about. Can I connect with that person's mind? Can I understand issues that are there that I might be expecting to be there, but also ones that I don't expect to be there? Because if you don't tackle them, either they're going to come out in the second half when you're doing your management plan, which could throw you, or they don't come out at all and the person goes home with those issues in their mind. Give another example. Someone comes in with a headache. You do a perfect clinical workup. You ask the right questions. You rule out the red flags. You do an examination. You diagnose a migraine and you treat the migraine. You think you're doing a perfect job. The patient goes home and doubts are in their mind. My sister had a brain tumor 20 years ago. I'm pretty sure it's not a brain tumor. I'm pretty sure it was a migraine myself. But what if deep down there was a first sign of a brain tumor? And what if that doctor didn't look for that? What if they didn't consider it? Do I need to go back again and make sure I get that thing ruled out? Why? Because it's a concern. There's an issue in the patient's mind. And if you haven't done the C part, okay, it might have come out on its own. But if you haven't done it and got it out, then there's a chance that either it's going to come back in the second half when you're not expecting it, which can go and influence again what you have to ask again. So you have to go back to data gathering, or it doesn't come out at all and you miss the fundamental point about understanding a person's mind. Now remember, when you're doing management plans, yes, you're trying to manage a problem, or you're trying to manage a clinical condition, or you're trying to manage a symptom. But don't forget, in communication skills based exams, or any clinical exam where there are role plays, yes, you need to do that bit, but if you're going to manage the situation as a whole, you've got to include managing the person's mind issues as well. And if you haven't understood those mind issues in the first place, then how can you manage them in the second half? That means your management plan is going to be incomplete. You think you've done a great job. You think you managed the knee pain amazingly well. You think you managed the migraine amazingly well. But remember, if you're not managing a patient's mind in a comm skill exam, then you may be missing the whole point. Maybe that it was designed to be so straightforward clinically that no one is not going to get the clinical problem. But again, if you haven't understood the mind, maybe the whole assessment in that scenario was, can this doctor understand what's going on inside here? And can they put a management plan in place that takes into account those issues that they've worked hard to get? Now, ICE is a tool to understand those issues. There are many ways that you can understand those issues. ICE, ideas, concerns, expectations, is just a tool. Now, a lot of people do ICE for the sake of it. Let's ask I, what's your idea about what's going on? Let's ask C, what's your concern? Or let's ask E, what do you think we should do about the expectation? But they're not demonstrating that they're understanding the importance of understanding issues in their mind. It kind of comes out as a formulaic approach. So go to our other videos on YouTube, Twitter, Instagram, Facebook, or wherever you want to find them. You'll find videos about how to make it less formulaic and how to make sure you're connecting better, for example. But so many people do all of that, but they still don't understand the whole point of doing ICE, which is to understand the issues in the patient's mind. There are lots of issues that you have to understand as a clinician: medical issues, psychosocial issues, mind issues, so many. But the mind issues are the ones that are so powerful for the person in front of you. And if you haven't understood those, or worked to get them out, or worked to show that I'm interested in understanding your mind, then management plans can often be left unsatisfactory, unfulfilled, with multiple gaps in them, even though we think we've done a great job as a clinician. I'll go and look at the videos, hopefully you'll get some value from those. But when you do a role play practice now for RCA, for CSA, for PLAB 2, for medical school stuff, whatever it might be, really understand the concept of ICE. I want to go in and I want to understand the issues in the patient's mind, because it's going to help me manage that situation and ultimately that patient and ultimately that case much better, and hopefully have a better outlook on the person that's watching behind you, hopefully giving you the marks that you deserve. Now, we've got 10% off. We've got 10% off any of our communication skills based teaching. We do loads of teaching on this, whether it's day courses or online courses or audio courses, for things like PLAB 2, for RCA, for CSA, for medical school exams, for general communication skills exams. Go to the website for 10% off and use the code AURORAVIDEO10, ARORAVIDEO10, and you'll get 10% off. And I know this code has gone around many people, lots of people have used it. I don't mind, but hopefully you can use it to boost your communication skills for an exam that's coming up in the near future. But please, 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 when you do ICE, understand the concept. I want to understand the ideas that are going around in that person's head. That doesn't just mean I've got pain. What do you think the cause is? What are the ideas behind the pain? What are the thoughts going on about that pain? That could be what it is, but it could also be lots of other things as well. Like, what do you know? So someone comes with osteoarthritis. What do you know about osteoarthritis? That's ideas. What are your ideas about the condition? Huge topic in itself. Concerns, anything particularly worrying you, not just about the pain, not just about worries about what it could be in general. What's worrying about you in general? It's an issue I want to understand as a clinician. And then expectation. What did that person come to the doctor for? Was it reassurance? Was it for a treatment? Was it for a diagnosis name? Was it for a test? Was it for a referral? Was it just for someone to talk to? But again, do the work and understand the expectations. But all these three, remember, come under the term issues in the patient's mind. We talk about it a lot. It's part of your data gathering, history taking, whatever you want to call it. Because remember, if you don't have those in the first half, either they're going to come out in the second half when you're not expecting it, or you're going to leave them behind completely and leave out a huge part of how to manage that situation in front of you. I really hope this was some value to you. Have a look at the website for all the other teaching that we do. Have a look at it on social media, YouTube, Instagram, Twitter, Facebook. You'll find loads more communication skills video there. Don't forget the 10% discount code is AURORAVIDEO10. Audiobooks, online courses, and day courses as well. Have a good day. #CampAsWebAs. #I went with Aurora.